This demonstration of the eHealth Box software will be shown from the perspective of 4 typical users, 1 patient and 3 medical professionals. These are a general practitioner, a specialist working at the local hospital, and a home nurse. Let's start with the patient.
Joan Hansen is 65 years old. She is a retired secretary and she lives alone. She suffers from type 1 diabetes and COPD. During a visit to a general practitioner, she has been offered to try eHealth Box, consisting of a tablet computer and peripheral measuring devices. She's been using these devices on a daily basis for the past 3 months. The daily routine consists of measuring her pulse, blood oxygen saturation, and lung function. Furthermore, she answers a short COPD questionnaire. Having finished this, she is presented with an overview of previous and current results. Upon reflection, Joan decides to review her results once more, this time using her PC browser instead of using her tablet, as she expects to write textual input to supplement her measurements. Being a retired secretary, she prefers a physical to an on-screen keyboard. Today, Joan is not feeling particularly well, and she is slightly concerned. After measuring, she is presented with the current and previous results, and these seem to confirm her concerns of an exacerbation. Seeing the results only confirms her suspicion that her condition is deteriorating. She makes a note of her concern and how she is feeling in the diary section. Not feeling well today, having trouble breathing and more coughing. Had to pause twice going up the stairs. After thinking about it for a few minutes, Joan decides to write a message to her general practitioner, Michael Keaton, addressing her concerns. Not feeling well. Hi Michael, I'm not feeling well today, and I have increased coughing and difficulty breathing. I also see my daily measurements for FEV1 and saturation are deteriorating. Could you take a look at my results over the past month and tell me what you think? Kind regards, Joan.
Value proposition for the citizen. The citizen is empowered and included in the monitoring, decision-making, and given an active role in his or her own treatment. The citizen is granted easy access to other citizens, doctors, GPs, and home nurses. The citizen is in general offered a coordinated treatment from the healthcare system. The citizen is granted an overview of all health efforts despite multiple providers and multiple conditions. The citizen is offered questionnaires that helps him or her to prepare for consultations from home. Finally, the citizen is offered shared information. That means that the citizen will avoid being asked the same question again and again throughout the healthcare system.
Michael P. Keaton is a general practitioner. He's been having Joan among his patients for 14 years and has treated her COPD for the last 12 years. Michael is working in eHealth Box when he sees a notification of a new message in his inbox. Michael reads the message from Joan and quickly decides to take a look at her latest measurements. He closes his current patient and finds Joan Hansen in the system. On the Citizen Overview page, he has an overview of Joan's conditions and how long she has had each. He can also see the questionnaires that Joan has answered. He reviews the relatives and is reminded that Joan's daughter lives nearby. He remembers that she is a nurse. She has been present during previous visits and can be counted upon to participate in keeping an eye on Joan. Michael reviews Joan's latest measurements. After looking at Joan's data, Michael wonders whether Joan's medication dosage is too low. Michael looks at Joan's current medication and decides to up the dosage of Spirocort from inhalation once daily to inhalation twice daily. He changes the dosage directly in the system, which will also be reflected next time Joan logs onto the Citizen web. Michael remembers that a colleague of his, a COPD specialist, works at the local hospital. This colleague has had success with a new type of medication which Michael thinks could benefit Joan. Michael takes a look in Joan's calendar to see if she has any upcoming appointments at the hospital. Michael is hoping he can get Joan an appointment with his colleague on the same day when she's at the hospital anyway. Joan has a 6-month checkup at the hospital in 2 weeks. It should be possible to set up an appointment with his colleague, so Michael arranges this. Afterwards, he needs to inform Joan of her new appointment and explain why he has increased her medication dosage. Under normal circumstances, he would make a video call to the patient to get a face-to-face talk and a visual assessment before changing medication. But Michael knows Joan well, and he knows it will not be a problem increasing the dosage. Furthermore, he can follow her daily measurements, so instead, Michael writes a message to Joan. Hi Joan, thank you for your message. I have looked at your data and think that the short-term solution would be to increase your dosage of Spirocort from 1 inhalation daily to 2 inhalations daily. Long-term, I would like you to see a colleague of mine at the hospital. He has had success with a new kind of COPD medication. I really think this new medication would be something you could benefit from. I have booked an appointment with him on the 1st of February. This is the same date as your 6-month checkup. Best regards, Michael P. Keaton, GP.
Value proposition for the GP. The eHealth box enables remote monitoring of the GP's patients so that the GP will know if a citizen needs extra care. The eHealth box coordinates services better, so that, for example, bookings can be coordinated with the patient's other health activities at the hospital or with the home nurse. It offers better information access, for example, communication features like messaging, video conference, shared data results, etc. The eHealth box decreases phone calls for the GP since all communication is centralized and accessible. All the existing resources used for coordination phone calls can be eliminated. Finally, it offers more effective consultation using questionnaires so that the GP can prepare before the consultations and use the consultation time more effectively.
Alex Salmon is a diabetes specialist working at the local hospital. In the morning, Alex likes to go through the journals of his patients for the day. When looking at Joan's journal in his EMR system, he's made aware of a shared care notification. Through this, he opens Joan's file. From this, he gets updated information on her health status and medication. He furthermore has a complete overview of all treatments Joan is getting and a checklist for her 6-month checkup. Finally, Axel looks at Joan's calendar and notices a new appointment with a COPD specialist after his own appointment. Alex makes a note to himself of asking Joan about this visit.
Value proposition for the hospitals. The eHealth box proposes better on-demand information access, that is through communication features like messaging, video conference, shared data results, etc. The eHealth box offers business intelligence tools on big shared care data. These are data used, for example, by doctors in research. Since all data is structured using template treatment plans, it's very easy to do research using the big data store. The eHealth box offers better treatment before and after the citizen is hospitalized, because the doctor has easy access to the citizen's health data and can therefore better prepare the treatment. Finally, structured pathways give the doctor a standardized and structured pathway to add data and results about the citizen's chronic disease.
Diana Smith is a home nurse. She works with diabetic ulcers. Every morning, Diana reviews her patients for the day. To prepare herself for her upcoming appointment with Joan, she reviews Joan's information and the results from the 6-month checkup Joan attended the previous week. This to ensure that she's up to date when visiting Joan to review her ulcers. In this way, she won't have to ask Joan questions previously answered in a different setting.
Value proposition for the home nurse and the municipality. The eHealth box enables access to clinical data, so that, for example, the home nurse can see if a citizen is struggling to keep the weight and consequently she can change the diet plan. It offers better on-demand information access. Again, the communication features like messaging, video conference, shared data results, etc. relieves the home nurses and the workload in the municipality. The eHealth box offers the structured pathways that also give the home nurse a standardized and structured pathway to add data and results about the citizen's chronic disease. So what are we talking about? Telemedicine, empowerment, shared care, and pathway.